Well, welcome everyone. I'm going to be a little distracted here as I make sure I'm letting everybody in, but I just wanted to do a quick introduction and thank you all for being here. My name is Shelby Rogal. I'm the Professional and Organizational Development Director with Montana Nonprofit Association. Those of you who have joined us for town hall previously know that we do what we do because we believe nonprofits in Montana are vital to our communities, our families, our health, our safety, our livability in any time. And especially in times like these, many of you are on the front lines of coronavirus and the front lines of our communities, making sure that those of us who need childcare or healthcare or mental health support or other frontline services are able to get what we need. And so because of the additional stress and pressure that all of you are facing right now, we've put together these town halls in order to address your needs in real time and provide opportunities for you to connect and access resources that are timely and relevant and up to date, and also to connect with each other, because a lot of you are facing the same hurdles across the state, and we want to make sure you're able to connect. Today, I'm really excited. We've got a great topic for you today, but before we get to that, I'll do a little housekeeping. We are going to hear from 3 folks from across the state on best practices and good ideas to keep your staff, volunteers, and clients as safe as you can. After intros, they'll each present on their work and best practices, and then we'll open it up to some questions at the end. Feel free to chat questions in or raise your hand and ask them, and we'll keep track and answer mostly at the end, but if there's some things we can answer throughout, we'll do that as well. I do want to note that the purpose of this is to hear best practices from some really well-qualified individuals and share what might work for you or organizations you work with in Montana. However, I do want to note it shouldn't replace viewing OSHA or CDC guidelines for public health or workplace safety, and so I'm going to send along some guidelines and toolkits as resources for you to use. But I do think today's conversation can help us all, whether we're working in direct service or supporting people who do, or if we're just going to the grocery store. It'll help us all have a better understanding of the limitations of social distancing and what else we all need to be doing to keep ourselves and each other safe. And the 3 folks I have, or we have lined up for you today are wonderful, and I'm excited to hear what they have to say and to share that with you guys. So with that, I'm gonna go ahead and introduce our panelists. So we have Kelly Rosenleaf, and she is the Executive Director of Child Care Resources based in Missoula. She is the President of the Montana Child Care Resource and Referral Network, and organizational members of that network serve child care businesses and families with young children statewide. We have Robert McCormick, who has over 20 years experience in hand hygiene research, first as a clinical trials principal investigator and then as a clinical trials consultant nationally. His research has been instrumental in the creation of novel hand disinfectant methods such as surgical scrub procedures, healthcare personnel hand washes, and the Sanitwice method, as well as FDA approval of various skin sanitization products. Rob, I should have asked you if that allowed you to have a surplus of sanitizer for us, but we're really, really grateful to have your expertise here. And Rob now just goes by Rob and is the Executive Director of Gallatin County Love, Inc. We also have Jesse Jager with us today, and he is the Director of Development and Advocacy for the Poverello Center in Missoula. He leads the center's fundraising efforts, works to empower the voices of the Poverello Center's clients and staff on policy issues impacting them, and helps tell the story of Poverello Center to the wider community. As the largest homeless shelter in Montana, they've done a lot of work figuring out what the best practices are as they move forward. Okay. With that, I'm going to go ahead and turn it over to Rob first to talk a little bit about what they've been doing at Love, Inc., as well as his background and what he's learned in terms of safety protocols that we can all follow, but especially those working with communities in direct service.
Well, thank you so much. I really appreciate it. So I know that in these times, we're probably all becoming virus experts, which makes it kind of interesting. And the experts have all sorts of varied opinions, as anyone does on a topic, from this isn't really a big deal to this is, the next really horrible thing that's hitting us. And the way that we feel is probably it's a horrible thing, and kind of struggling with that. So what I wanted to do is just talk briefly about what a virus is. A virus is not alive. It's not something that we can actually kill. It doesn't have a cellular structure of its own. It's a bundle of RNA or DNA or genetic material that is coded by a lipid or protein that's trying to find a cell to infect and then begin reproducing itself as much as possible. So uh, we don't need to, what we need to ultimately do is disrupt its ability to replicate or to make more of itself. We've seen the hand washing guidelines, and hand washing, unless you're using a virucidal product, doesn't actually kill or disrupt the virus's mechanism. Instead, it's a mechanical removal. And that's why they say, sing 2 ABC songs or do at least 30 seconds of hand washing so that you can mechanically remove it from your hands. There's a number of hand washing products that are out there that actually do disrupt it. And most common are the hand sanitizers that we've been using. And those need to be an ethanol based of over 60% or an isopropyl base of over 70%. The most common product that people are using on surfaces, however, is the dilute bleach solution. Pardon me. Out of at least 100 parts per million sodium hypochlorite. And that's used for surfaces as it's appropriate, which explains the popularity of the Clorox wipes. The CDC and EPA websites have a very complete list of those products if you're interested in looking at it. It can be a little overwhelming. But what we're dealing with, the coronavirus, has been proven to be deadly and can be spread from droplets produced by an infectious person's cough or sneeze. It's inhaled by those nearby or picked up from a contaminated surface. Now, one of the things recently that came out that was a little scary, there's research done in Japan that they were looking not at the droplets, but the micro droplets. A droplet would be about 1 millimeter in size. And if anyone has watched someone while they talk and they're spitting out droplets, you know what I mean? They're about 1 millimeter and readily visible, but there's micro droplets that are about 1/100th in size that are produced at the same time. Now, while the droplets only remain in the air for about a minute, the micro droplets can be remained in the air in a room that's not well ventilated for over 20 minutes. And so we have to be aware of that as we're trying to create protocols for our sanitization. The coronavirus, the COVID-19, is also incredibly infectious. The common flu is, well, let me rephrase it a different way. It's over 3 times more infectious person to person than the common flu. There's called an R0 value that rates how many people a single infection will be infecting. And so the regular flu is somewhere about 1.28 people that a person with the flu would be infecting, where this virus is about 3.5. So for every person infected, it can infect up to 3.5 other people regularly. And if you think of that, the 3.5, then all infecting 3.5 and so on, you see how it's infectious can spread so rapidly through places that we see in like New York. Now, there are good news for the microdroplets. If you're in a well-ventilated room, you can disperse them by having a flow come through, and that would remove them from the area that you're working. Now, on the hard surfaces, we can also pick up the virus. Think of it, for those of you that have children, if a child is eating and gets some sort of food all over their hands, or a person that's painting that gets paint on their hand, anything they touch then becomes a puddle of that virus. And then for a prolonged period after that, anyone that then touches that spot then picks up that virus and can transmit it into their own mouth or nose or somewhere that it can become infected. The National Institute of Health and Johns Hopkins University, as well as the World Health Organization, have put out that it can last on surfaces anywhere from 3 to 5 days if it's a hard surface, on 24 hours on cardboard, and 3 hours in the air. Again, the research they had done said these micro droplets are hovering for about 20 minutes in a cloud, so to speak. So our job is to limit the transmission by reducing contact through the sanitization of materials being delivered, as well as the surfaces that we're working from. So how do we limit the spread of the virus? Well, each organization has to think about how they conduct business and then modify their procedures according to it. So we need to be mindful and intentional, knowing what causes the infection and limiting that possibility by, again, hand washing and regular disinfection. At some offices in particular have implemented a brief questionnaire and are taking temperatures to screen staff and volunteers for work. One of the things that they found out is that the virus can be spread by people that are asymptomatic, meaning they're sick but never have the symptoms associated with it, or pre-symptomatic. You can be infectious prior to knowing that you have the virus, which is kind of difficult. So, and those micro droplets can be spread during conversation. So if you're standing next to someone that either is not expressing those symptoms or it's before they're going to get them and they're talking to you, they could be filling the room with virus and neither of you know that. And that's where the importance of wearing the mask comes in. The mask has the ability to either stop the transmission from you, if you have the micro droplets and droplets that you may be spreading, or your inhalation of them from those around you. Gloved hands also help, but you have to keep in mind that once you glove your hand, the outside of your glove is only as sterile as you keep it. So if you were the one to put your hand in that puddle of virus without constant disinfection of the hands, then you would be the one that was putting it on other stuff. And then when you remove those gloves, you have the possibility to get it on your hands. So at Gallatin County Love Inc., we've implemented operational changes in response to the community COVID directives. Anyone receiving donations, for instance, we quarantine our donations. So anyone that's bringing them in, well, I'll step back for a moment. We leave all donations outside the building, and then we have certain individuals, staff members that are receiving donations. They need to wash their hands and glove up before they go get them. They then have to sterilize their gloves in between handling, going from a dirty to a clean space. And then if the donations themselves don't lend themselves to be sanitized immediately, they're quarantined for a week. So any virus that may be on them is killed off before it's given to someone that may be at risk. We then, for the staff, we've closed down the office buildings. We still are working here. As of today, we finally got all of our laptops VPN, so now we can work remotely. But what we need to do is we need to clean into the area and then we clean out. And what that looks like is, I call it the Mr. Rogers rules. If you have a staff that's going to be here, they want to leave shoes or a coat that they can wear within the building, that they're not bringing any environmental contaminants into the building. They come in, remove their coat, then they wash their hands, then they can put on the indoor coat. They would glove up, and then they would use the Clorox wipe or a sodium hypochlorite solution to wipe down all commonly used surfaces. All the tables, all the doorknobs, all the light switches, all the desks. We want to routinely clean the computer keyboards and not share them between people. We want to make sure that we clean everything on the way in, and then they can choose to leave their gloves on and regularly disinfect the gloves with hand sanitizer, or they can discard the gloves and regularly disinfect their hands with hand sanitizer. You want to work remotely whenever possible. And what we did is we switched all of our classes, and all the meetings were moved to online video conferencing only, like we're doing currently. And depending on what classes you're using, if you need to have one-on-one discussions and not just a mass talking like we're currently doing, you can set up Zoom meetings to have breakout groups where the people can meet in smaller groups. The facilitator can go from group to group and so on in order to facilitate that. Again, we wear masks to significantly reduce the droplets that are transmitted both from you and to you. That's kind of a really big deal. And we've closed off the majority of our physical site locations and have limited access to the ones that we still have operating. So only the same people are using the same computers, and they're scrubbing in and scrubbing out, as I had previously mentioned. We're using our social media to remain in contact with our community. We're constantly putting out encouragements, giving them updates on what we're doing. For our deliveries, we have a very specific protocol that the people use. They open their trunk, they come in, then in the outer vestibule only, they don't come into the hallway. They wash their hands and then they don gloves. Then, with the gloved hands, they disinfect them with alcohol bottles we give them. Once that's dry, because it's the evaporatory part that kills or disrupts the virus, they pick up the donations, bring it out to the car, put it into their car, close the trunk, drive to where they're going, disinfect their hands after opening the trunk, lift the donations, and bring it to doorstep only. That way, we're minimizing as much as possible the transmission. And the whole time they're wearing a mask, so they're not adding droplets onto the surfaces. Amazon had put out a recommendation that when you receive their boxes, you should either disinfect the exterior and interior of the boxes when you get them prior to removing your contents, or put them in isolation and quarantine for a while to make sure that that is now sterile. The virus lives on cardboard for about 24 hours, but we don't know if the person delivering it has just contaminated it when they bring it up. And I haven't seen any of the FedEx guys wearing masks or gloves, but I would have recommended that had they asked. We primarily employ volunteers that are not in the vulnerable population unless we're doing it remotely so they can be safe at home when they deal with that. And that's when we're mobilizing volunteers by having them doing what we call words of encouragement campaign. And they're calling other volunteers and other clients to make sure that they're okay, or writing letters and sending to them so that they can continue to do that outreach. If you're supplying food items, you should scrub into the area you're going to be distributing or creating the food boxes, and be very aware of the dirty versus clean areas that you're moving into and out of, and disinfecting your hands when you're going from a dirty to a clean in order to make sure that you're not bringing that contaminant over. You may also want to consider going from fresh fruits to frozen so you could disinfect the outer containers if need be. So be very aware of the contact between staff, the volunteers, donations, and our neighbors that are in need, and sanitize at every step to reduce the transmission of the virus. And if anyone has any questions at the end, I'd love to answer them. But I recognize that we can't make sure that everything that we're doing is virus-free, but we can be very intentional and mindful of everything to mitigate that risk as much as possible, because we don't want the potential harm to be distributed with the help that while we're helping those that need it. And my timer says that I'm up, so
Well done.
thank you so much.
Rob, thank you. Thanks for bringing your great expertise and background in clinical research and trials to bear, and then also witnessing how you're applying that to the work you do with deliveries and donations and setting up clean spaces and dirty spaces. It can seem overwhelming, but I've now heard, I heard this last week and I'm hearing it again now. It seems like it's a little more accessible every time. And so thank you for sharing that. And I think there's some great information in there for folks that are in the line of duty. Kelly, would you like to share a little bit about childcare and what you guys are doing across the state in that arena?
Nice to be on here with you. Thank you so much for inviting me. I see Colette Box is on the call, and Colette is a child care center director in Kalispell. Been doing that for a long time. So I don't know any of the other names here, but I'm happy to see a child care person here. So we help both childcare providers and parents. And the first thing I want to say about the childcare business and early childhood professionals is that we are a bunch of professional hand washers and sanitizers, because young children put every single thing in their mouth. So the business of childcare involves disinfecting things with a bleach solution all the time. And in fact, childcare facilities are not supposed to be using those Clorox wipes because they might not have the right amount of bleach on each little piece of paper towel thing that's in there. So childcare providers use a bleach water solution, spray surfaces and wipe them off. They wipe off horizontal surfaces, they clean toys, they clean all kinds of stuff. And young children are unable to social distance. They do not understand being 6 feet apart. Even if they understood it when you talked to them right in the moment and showed them how, they'd forget about it 2 minutes later. And it's impossible for childcare providers to social distance from the children in their care. They have to help them wipe their nose. They have to help them tie their shoes. They have to help them wash their hands properly. It's just impossible. So what we've seen is that about a third of the childcare facilities throughout the state have actually closed. And those that are open are typically serving a lower census than normal. And under the governor's advisory and directive around childcare and what public health professionals are recommending is groups no larger than 10, including the teachers. So that's a smaller group than is typically the case in a childcare center. Many centers have 20 children in a room with multiple teachers. So, and the other thing that's recommended to the extent possible is to keep sibling groups together. So in a center, normally you have age-based classrooms. And so babies are in one room and 3-year-olds are in another room. Now, to minimize the risk of transmission, all the kids of a couple of families or however many make 8 kids, because there's maybe 2 teachers in there, are going to be in one room, and they're going to be in that same group every single day. And childcare facilities are taking temperatures and asking some screening questions on the way in every day, and sometimes taking temperatures at midday, like at nap time. They're already singing and washing hands all the time. In fact, my organization, Childcare Resources, made a video about that years ago to help train new childcare providers how to properly wash your hands, which includes not turning off the faucet with your clean hand, using the paper towel or whatever towel you have to turn off the faucet. So they're already doing that. They're doing it more. They're sanitizing toys more. Some of the facilities have removed some of the toys, so they just have fewer toys. As they have fewer children, that might be okay, but it's just less to sanitize multiple times throughout the day. They're already sanitizing sleeping mats and all that kind of stuff. So those procedures are always critically important with this population. They continue. Because a number of facilities are closed, they're also trying to reach families. Many of the closed facilities are charging tuition, because if they don't do that, they will maybe not be able to reopen. And as we have a shortage of childcare, parents are wanting to keep their slots so that they'll have a place to go when this ends. So what we do see is childcare professionals reaching out and doing online streaming story time at a certain time of day. We see them doing Zoom with 3-year-olds, and Rob was saying earlier he had to go over some Zoom etiquette with his young child who took the phone into the bathroom during the Zoom call, which is not a surprise to me, and they stick out their tongues and do all kinds of crazy things because they're children, little children. So organizations like mine around the state are also putting out guidance for parents around creating schedules for children, trying to manage their own stress so they don't pass it on to children, about using this time to really connect with their children and do some fun things, not focus on, learning, structured learning, which we shouldn't be doing with young children anyway, but engaging with children, playing with children, free play, art projects, walking outside, all that kind of stuff. So the young children might remember this time as a really fun time with their parents. And so that's going on. We also, our organizations are reaching out, calling childcare providers, just checking in, trying to keep folks up to date on the federal stimulus things. There are some stimulus things for childcare. Montana has not really rolled them out, needing approval from the governor's office, and that process is moving on. So we're trying to keep childcare providers and parents apprised of those changes and those policies as they come out. Many of us have put a COVID-19 page onto our website where we keep all that running information. We're sending electronic newsletters to our customers. We offer childcare scholarships, and those applications are available online. But if parents want us to mail them one, we will. Most of our offices are closed around the state, but we're working from home to the extent that's possible. We do professional development workshops for childcare providers. We're still doing them mostly by Zoom. And we had to cancel some, of course. When we get ready to go back to the office, we're paying our cleaning service, and they know we're not there, and we don't care if they go in there. We're still going to pay them, but they are going to do a very deep cleaning for us before we return, sanitize all of our surfaces and all that stuff. Our computers are all at home with us, so we'll expect our staff to sanitize everything on the way back in. And then we don't think it's going to be business as usual. When we are able to go back to work, we're going to need to sanitize our front counter more often. We're going to have fewer toys in our reception area and in our caseworkers' offices, so it's easier for us to keep those sanitized. Before we closed, we had a clean pen and a dirty pen cup on our counter, and we sanitized pens at the end of the day that had been used. Using that Clorox wipe, we'll continue to do that. Right now, we are not doing fingerprints. Nobody in the state is doing them except police for police purposes. But when we go back to doing that, we will just be more mindful of our sanitation procedures for the staff that do them, and also for our customers who need to be fingerprinted. So that's going on. We also have a drop box. We've had it for many years to just make it so parents and childcare providers who have young children in the car can just drop their paperwork off without coming into our office, which means getting the kid out of the car seat and into the stroller and into the office and all of that. So we will encourage people to go ahead and continue to use that as well. We check that and get stuff out of it multiple times a day. It's convenient for people who have young children, but we'll just work on, so that continues to just expose them to less risk. So childcare providers are essential workers, and without them, other essential workers would not get to work either. So we want to make sure that they have the support they need in this time. And we are advocates for how that money will be spent, because there's about $10 million coming into Montana out of the CARES Act specifically for childcare. And we want to get that into the hands of childcare providers so that when we're ready for people to go back to work, that the facilities will open and be at capacity. So that's our goal.
Wonderful. Kelly, thank you. And I think that point is well stated, that childcare providers and facilities do a lot of work and have always done a lot of work to keep things as clean as they can, because of everyone putting things in their mouths. But I love your consideration of what it looks like when you go back into service and some of the things in your own office that you'll be changing. Again, for those of you who are in direct service or not, or just going to be maybe returning to an office, that point is well taken, that things will not be normal for a while. And so thinking through what that process looks like for you is really appreciated. So thank you, Kelly. Jesse, I will hand it over to you.
Hi, everybody. My name is Jesse Jager. I'm the Director of Advocacy and Development for the Poverello Center. The Poverello Center is Montana's largest homeless shelter. Our mission is to provide food, shelter, help, and hope to all who ask. We have lots of programs, but our two core programs is an emergency shelter that provides shelter to up to 150 people during warm weather months, and then up to 175 during cold weather months. And then we also operate a soup kitchen that serves about 300 to 600 meals a day, 3 meals a day, so breakfast, lunch, and dinner. And so, as you can imagine, the COVID-19 pandemic has dramatically impacted homeless shelters across the country, and that's definitely true for the Poverello Center. People experiencing homelessness are uniquely vulnerable to the COVID-19 virus. They tend to be older. They tend to have health concerns that relate to respiratory issues, things like that. So their health, they've got pre-existing health conditions that can then dramatically impact their health related to COVID-19. And then they tend to live in congregate living settings. So places like shelters or in communal camps or doubling up in people's homes or in vehicles and things like that. So, homeless individuals, people experiencing homelessness are very vulnerable to the COVID-19 virus. We can just see the impact of what that can happen if you were following the news in San Francisco. In one day, 70 people in a homeless shelter were tested positive for COVID-19. We're working very hard at the Poverello Center for preventing that from happening. Like a child care center, social distancing in a homeless shelter is very, very difficult. And it causes us to make some fairly challenging decisions. Competing between keeping people fed and have a roof over their heads versus the need to social distance and spread people out is really challenging. And we've been having, trying to figure them out on a day-to-day basis. Some of the big things that we're trying to work on kind of fit into 3 categories. One is around staffing, the other is around protecting our guests, and the third is around facility changes, and they're all kind of interrelated. One of the very first things that we did when we started the planning process around COVID-19 is make sure that we had a sustainable staffing structure in place so that we could staff the shelter for the long haul. We identified which of our staff had concerns that would not allow them to come into the shelter at all, and we needed to protect their health and set up systems for them to work at home. And then for everybody else that was considered non-essential staff, so staff that didn't need to immediately be in the building at all times, we started having everybody work at home so that if we start having a situation where staff gets sick, if we get one positive test amongst a staff person, that could take out a whole group of staff that would need to then quarantine. So we needed to make sure we had a backup plan and backup staff ready to go and move into the shelter and work direct care shifts. So that's a part of our planning process, is to make sure that we have that plan in place and sustainably laid out. So that's a big part of it, is making sure our staffing and everything's figured out. In terms of what we're working with our guests, is that we are wanting to make sure our guests are healthy as much as possible. So we are lucky to have a Partnership Health Clinic, has a clinic in the Poverello Center. We've partnered with them and the Missoula Health Department to do screenings of everybody in the Poverello Center multiple times a week. So everybody in the Poverello Center is getting screened, including staff. And if they need to get tested, they're immediately removed to another facility away from the Poverello Center that's managed by the health department, where they can be in isolation or quarantine until they get the test results back. For staff, if they've gotten a test, they are asked to stay at home. I experienced this myself last week. I was in quarantine in my basement, this room that you see me in right now, for 48 hours, waiting to get back the results of a test. So we're really being careful about that. We're regularly screening everybody to make sure we're staying on top of if the infection is coming into the building, so we can act appropriately. And then we've also, worked hard in terms of social distancing in the building, and that has to do with a lot of different types of facility changes that we've done. One of the big ones is that we are regularly cleaning our building. We have a really rigid sterilization process where sections of the building are closed down and have a deep clean done to them every day to sterilize sections of the building. What this means, though, is that we're having to close our building down and people have to be outside for periods of the day, which is a challenge, particularly with the weather's been the way it's been in Missoula the last couple of days. We are changed up our entire food serving process, and we only allow about 26 people in for a meal at a time, and everybody spread out at least 6 feet apart, only 2 people to a table, and those types of things, so people are spread out as much as possible as we continue to serve meals. And then finally, in terms of the facility pieces, this is actually happening as we speak, is what we're doing is we're de-intensifying the shelter. And what that means is that we're reducing the number of people who can sleep here. We normally would, this time of year, be sleeping 150 people a night. That's going to get cut down to 98. Our executive director, Amy Aslin Thompson, went with our facilities manager and measured the building and figured out what the best layout was going to be to make sure people are as spread out as possible while we're sleeping people. That means we've got bunk beds set up in places we don't normally have bunk beds in the POV so that we are as spread out as possible. But that's going to be a real big challenge in terms of a lot more people are going to end up not being able to sleep at the Poverello Center. We're seeing a lot more people in our community sleeping outside, out in encampments. There's encampments that are growing all across Missoula, and this presents a lot of really serious challenges. Our homeless outreach team is working closely to go out and interact with people, get them resources that they need, make sure they're educated about COVID-19, and make sure testing is happening out in the camps. But it is just harder to get services to people. At the same time, normal gathering places that people experiencing homelessness would go to are shut down. Places like the library and things like that, where people tend to go to stay warm. And so all of those things are making things pretty challenging in terms of serving people that are experiencing homelessness. So what we are expecting and what we're doing is working really closely. Missoula has formed a COVID-19 task force that's made up of agencies and government officials to address this issue, planning, looking for secondary shelter options. The city is in the process of buying a hotel here in Missoula, or a motel here in Missoula, as a quarantine and also as a isolation facility for people that are at risk. So those are the things we're trying to do as a community to work together. And then we've got to really think about long-term issues. We're about to, there's the economic consequences of this pandemic and the closing down that's happened is going to be tremendous. Lots of people who were living on the edge, who are barely keeping by, are going to be knocked over the edge into homelessness and into food insecurity. So we have got to think strategically about what it's going to look like in the months to come, when we're going to have to figure out how to continue to serve people, possibly with not being able to have more people in the building, and think through this long term with a lot more people, some of which who've never experienced homelessness before, coming to our door looking for our services. So those are the main issues and main things that we're trying to achieve at the Poverello Center right now. Luckily, the Missoula community is rising up. We're getting a lot of support across all levels of the sector and community members who are coming and supporting the POV, which we very much appreciate.
Jesse, thanks for sharing that and really unpacking the multitude of challenges that you guys are facing. I think that, again, can feel pretty staggering and overwhelming, but it's comforting to know that folks like you and others across the state are really taking the lead in ensuring immediate safety, and then also starting to think long-term about what that might look like. Thank you. 3, do we have any questions from the group? Feel free to chat them in or raise your hand and ask. Or if not questions, any additional comments on things that you guys have seen work well or challenges you're having in direct service at your organization, maybe sectors that weren't mentioned explicitly here or other challenges you guys are having. I'll wait a couple seconds here for any questions to come through. As we wait, in case we don't have any, I just wanted to ask the panelists if you guys had some, if anything else had come to mind, or if you had some words of, you know, final advice or most important advice for individuals and for organizations right now. What would you share with them?
I would say one thing is that I think that in a crisis like this, it's very easy to get caught up in the dealing of the day-to-day, like what's right in front of your face right now, be it, you know, paying your bills or taking care of your staff or taking care of your clients. But this is a crisis that's going to go on for a very long period of time, and it's going to radically alter most of what we do as different types of agencies, really no matter what kind of work you do. So as much as possible, you know, try to get your board of directors and your leadership teams thinking about what is this going to look like, you know, 6 to 8 months, you know, 2 years from now. We've got a team of board and senior leadership on the POB that are already meeting and talking about that, because we know this is going to be something that we're going to be needing to address for the future.
I would agree 100% with that. And one of the things I noticed, as it goes on, people are starting to be a little bit more lax in how they're doing things. In particular, when I went to the grocery store, I noticed that the cashiers were, you know, accepting the money, then giving them back out to the next person without any disinfection in between. And at the time, I was told that it was because of the lack of products. But I think everyone just has to remember how it's transmitted and continue to be very vigilant in all of your activities. So going back to the analogy of a puddle of paint or the kids with dirty hands, that you're not the one that is putting that handprint for another person to come in. When you do things, particularly going from dirty to clean, you want to disinfect your hands. And we just recently, it came out that 3,000 food workers had caught the virus, and there was a significant number of deaths there. And it's partly because it's a concentrated area, and the protocols weren't as stringent as they needed to be, unfortunately. And so I just encourage everyone in your workings and your organizations and with volunteers and with clients that you keep it very stringent so that we can keep this continuously going down. Basically, we're in Gallatin County, I think we've had one new case that they're aware of in the last 4 days, which is fantastic, but that can lead people to really relax their guard. I know people are sending their kids back to daycare because they're kind of over it, but that could potentially increase the swing again. So just maintain your vigilant protocols, knowing how it's spread, and be ready for the long haul, because it will significantly change things moving forward.
Well said, Jesse and Rob. Kelly, how about you?
I have been thinking a lot about changes that we'll make going forward, and our board normally meets in person, but we can meet electronically. We can meet by Zoom, and I think we will continue to meet by Zoom rather than to gather that dozen board members and 2 or 3 staff members for each of those meetings. We do workshops with child care providers. We will either have fewer people in our conference room in order to allow greater distancing. We'll certainly sanitize our conference room before and after. We could, in some cases, rent a larger conference facility at a hotel in order to allow people greater spacing. And I've seen some very creative things that arts organizations are doing, for example, virtual tours of their galleries, some virtual art projects with kids and adults and things like that. And I think we all need to think about that, not just for now, but for ongoing for a while, so that we reduce the number of gatherings of people while still achieving our mission. I mean, there are some things that you cannot provide childcare without having them together. That's why as many parents as are able to are using informal caregivers. But when people go back to work, other workers go back to work, that won't be possible. We'll be back into childcare settings. So we just need to be very careful about where we gather, and what our organizations are doing, how we can minimize that and sanitize everything under the sun while we are gathering people and our own staff. So just look at systems and what you can do. We normally do a lot of on-site work at childcare facilities, and we're not able to do that right now. And we need to look at what has worked during this time where we haven't been there as far as providing support in the field, and how much of that we could maybe continue to just reduce the possibility of infection coming into their facility by one of us.
Thank you for that, Kelly. I think, in this conversation, what I've heard is that what's helpful right now is a really radical mixture of discipline on one hand, and then creativity on the other hand, both in your current operating procedures and how you're imagining your futures. I know we at MNA are in the middle of building out some of those mid and long-term planning tools and frameworks so that organizations can have some steps that they're able to take, because I think you three really hit the nail on the head. This is something we need to be vigilant and pay attention about now, and then recognize that it will change things and operations, and there will be a new normal, but it doesn't have to be a bad new normal. And so we can find some good solutions. And every day we get updates from organizations who are doing that across the state. And so there's that silver lining of the good work you guys are all doing. There was a question that came in through the chat, just for those of you on the phone. There's a question about coordination going on about homelessness on a state level. Jesse mentioned there is some coordination going on, largely around accessing funding from HUD and other federal sources. There's also resource and idea sharing going on regionally with shelters in the Northwest. Anything to add to that? Perfect. Wonderful. Well, I wanted to thank you guys all for being here. We'll send out some of the wrap up from this conversation and some guidelines. And I wanted to thank our three presenters. All of us are busy right now. These three are incredibly busy and really championing efforts in their communities and across the state, and really providing some insightful and thoughtful tools for us. So thank you three for being here, and we hope to see you tomorrow. We'll have a census webinar, same time, same place, to talk about what you guys can do to help support census efforts that will impact our state for over a decade to come. So we will see you then, and thank you all.
Thank you.